Good morning, everyone. Bonjour tout le monde. Welcome to this technical briefing on modeling and public health action on COVID-19. With us today are Dr. Tam and Dr. Njoo. Bienvenue à cette séance d'information technique sur la modélisation et les mesures de santé publique pour faire face à la COVID-19. Les Dr. Tam et Njoo sont avec nous aujourd'hui. As usual, a question and answer session will follow. Une période de questions et réponses suivra. Mais je cède d'abord la parole à la Dr. Tam. Dr. Tam, over to you.
And bonjour à toutes et à tous. Today, we'll provide an update on the national epidemiology and modeling work that informs our ongoing management of COVID-19 in Canada. Currently, there are less than 33,000 active cases, which is almost 60% fewer active cases than a month ago. Although the total number of cumulative cases has increased by over 148,000 to over 837,000 cases today, the rate of increase has slowed over the past several weeks. At the same time, COVID-19 virus variants of concern have emerged and now appear in 10 provinces. To date, there are over 660 B117 variants, 39 B1351 variants, and 1 P1 variant, and 5 provinces are reporting evidence of community spread and outbreak activity associated with these fast-spreading variants.
Bonjour à toutes et à tous. Aujourd'hui, nous ferons le point sur les travaux nationaux d'épidémiologie et de modélisation qui orientent la gestion actuelle de la COVID-19 au Canada. Présentement, il y a moins de 33 000 cas actifs au Canada, soit presque 60 moins de cas actifs qu'il y a un mois. Bien que le nombre total de cas accumulés ait augmenté de plus de 148 000 pour atteindre plus de 837 000 cas aujourd'hui, le taux d'augmentation a ralenti au cours des dernières semaines. Au cours de la même période, des variants préoccupants du virus de la COVID-19 sont apparus et ont maintenant été rapportés dans les 10 provinces. À ce jour, il y a eu plus de 660 cas impliquant le variant B117, 39 cas du variant B1, 351 et 1 cas du variant P1 et 5 provinces rapportent des preuves tangibles d'une transmission communautaire et d'éclosion associées à ces variants qui se propagent plus rapidement.
To slide 1, our daily case counts have been steadily declining over several weeks. But at the current national average of 2,900 new cases reported daily, case counts are still 60% higher than the peak of the first wave. With the emergence and spread of new variants of concern, we are cautioned that unless we maintain and abide by stringent public health measures, we may not be able to avert a reacceleration of the epidemic in Canada.
Diapositive 1. Le nombre de cas quotidiens a diminué de façon régulière durant les dernières semaines, mais avec une moyenne nationale actuelle d'environ 2 900 nouveaux cas déclarés chaque jour, le nombre de cas est encore 60 plus élevé qu'à pic de la première vague. Avec l'émergence et la propagation de nouveaux variants préoccupants, nous savons que si nous ne maintenons et ne respectons pas des mesures de santé publique strictes, nous pourrions ne pas être en mesure d'éviter une nouvelle accélération de l'épidémie au Canada.
Slide 2. Ongoing steady declines in COVID-19 activity has been seen in most provinces in Canada, including the most populous and heavily impacted provinces west of the Atlantic region. However, the rapid escalation of cases associated with the B117 variant in the Eastern Health region of Newfoundland and Labrador demonstrates how quickly the situation can change when you have highly contagious variants being introduced. Rapid, decisive public health response by the province is what is needed to stop a variant of concern in its tracks. Renewed activity has also been reported in Nunavut. However, there is no indication of new variants of concern in the territories to date. To maintain our progress in controlling COVID-19 and to prevent further accelerations, we need to keep the pressure on the virus, applying what works with even more diligence. Early, strong, and sustained community-based public health measures and consistent adherence to individual practices work best to slow growth, maintain low levels of activity, or eliminate transmission from an area. We still have a ways to go to see the widespread and sustained decline in disease activity and management of rapidly spreading variants that we need to be confident we can bring the pandemic under strong control nationally.
Diapositive 2. La plupart des provinces du Canada ont vu une diminution constante de l'activité de COVID-19, y compris les provinces les plus peuplées et fortement touchées à l'ouest de la région atlantique. Cependant, la croissance rapide des cas associés au variant B117 dans les régions sanitaires de l'Est de Terre-Neuve et Labrador démontre à quel point la situation peut changer rapidement lorsque des variants très contagieux entrent en jeu. Une réponse rapide et résolue de la province en matière de santé publique est nécessaire pour stopper l'avancée d'un variant préoccupant. Une recrudescence de l'activité a également été signalée au Nunavut, mais à ce jour, il n'y a pas d'indication de la présence de nouveaux variants préoccupants dans les territoires. Pour préserver nos progrès dans le contrôle de la COVID-19 et pour prévenir une nouvelle accélération des variants préoccupants, nous devons maintenir la pression sur le virus en appliquant ce qui fonctionne avec encore plus de diligence. Des mesures de santé publique communautaire rapides, fortes et constantes, ainsi qu'une adhésion constante aux pratiques individuelles vont plus efficacement ralentir la croissance, maintenir de faibles niveaux d'activité ou éliminer la transmission dans une région. Nous avons encore du chemin à parcourir avant d'observer un déclin généralisé et soutenu de l'activité de la maladie et un contrôle des variants qui se propagent rapidement. Ces étapes sont nécessaires pour être sûr de pouvoir maîtriser la pandémie à l'échelle nationale.
Slide 3. Since the last modeling update, the number of health regions reporting over 100 cases per 100,000 population, dark blue areas, has decreased from 59 to 35, as community-based measures have worked to reduce spread. Some Atlantic provinces have been able to sustain sufficient measures to manage importations, interrupt spread, and maintain strong control of COVID-19. However, as noted, Newfoundland and Labrador reported a recent surge in cases due to the introduction of the B117 virus variant. Renewed activity has also been reported in Nunavut, and all cases today are located in the Arviat area, and strong measures are being taken to prevent further spread.
Diapositive 3. Depuis la dernière mise à jour de la modélisation, le nombre de régions sanitaires signalant plus de 100 cas par 100 000 habitants, ce sont les zones bleues foncées, est passé de 59 à 35, les mesures communautaires ayant permis de réduire la propagation. Certaines provinces de l'Atlantique ont su appliquer des mesures suffisantes pour gérer les importations de cas, interrompre la propagation et maintenir un contrôle strict de la COVID-19. Toutefois, comme indiqué, Terre-Neuve et Labrador a signalé une récente augmentation du nombre de cas due à la transmission communautaire et aux éclosions associées à l'introduction du variant B117. Une recrudescence d'activité a également été signalée au Nunavut. À ce jour, tous les cas sont localisés à Arviat et des mesures rigoureuses sont prises pour empêcher toute nouvelle propagation.
Slide 4. In alignment with the overall decline in disease activity, infection rates have been steadily declining across all age groups for several weeks, and the incidence remains highest among persons 80 years and older, who are at high risk for severe outcomes, including death.
Diapositive 4. Parallèlement à la diminution générale de l'activité de la maladie, les taux d'infection sont en baisse constante dans tous les groupes d'âge depuis plusieurs semaines. L'incidence la plus élevée demeure chez les personnes de 80 ans et plus qui sont très à risque de subir des conséquences graves, y compris le décès.
Slide 5. Ongoing high rates of infection in communities continues to be a risk for new infections, more and larger outbreaks, and introduction into high-risk populations, such as hospitals, long-term care homes, and other close and close living settings, where spread can be further amplified. Although the number of outbreaks in long-term care settings appears to have declined in January, the introduction of more easily transmitted variants into these and other settings is a concern. In recent weeks, outbreaks involving variants of concern have been reported in a range of settings from long-term care homes, hospitals, and schools to apartment buildings, a workplace, and other community settings. Bringing infection rates and preventing the spread of highly contagious variants requires individual and public health authorities working together even more diligently, as these new variants provide far less margin for gaps and errors.
Diapositive 5. Les taux d'infection constamment élevés dans les communautés continuent de constituer un risque de nouvelles infections, d'éclosions plus nombreuses et plus importantes dans les milieux à haut risque tels que les hôpitaux, les centres de soins de longue durée, les établissements correctionnels et les refuges, ainsi que les espaces fermés où la transmission peut être amplifiée. Bien que le nombre d'éclosions dans les centres de soins de longue durée semble avoir diminué en janvier, l'arrivée de variants plus aisément transmissibles dans ces établissements et dans d'autres est une préoccupation croissante. Ces dernières semaines, des éclosions impliquant des variants ont été signalées dans divers milieux, allant de centres de soins de longue durée, hôpitaux et écoles à des immeubles d'habitation, lieux de travail et d'autres milieux communautaires. Pour réduire les taux d'infection et prévenir la propagation des variants très contagieux, les autorités de santé publique et les individus doivent travailler ensemble avec encore plus de diligence, car ces nouveaux variants laissent peu de place à l'erreur.
Slide 6. Indigenous populations are at a high risk for rapid spread of COVID-19 and potentially more severe outcomes, given an increased likelihood to live in multi-generational homes and in remote communities with reduced access to health and critical services. For example, unlike in the earlier stages of the pandemic, when many First Nations communities have been successful in their efforts to stop the spread, the rate of new COVID-19 cases in First Nations on-reserve populations exceeds that of the general Canadian population. In general, First Nations communities have higher attack and mortality rates when compared to the overall Canadian population. Infection rates remain high in many First Nations communities, and reintroduction and spread of COVID-19, including variants of concern, is an ongoing concern for all Indigenous communities. Another example, although case counts have remained low across the territories, a recent surge of cases has been reported in Nunavut. All cases to date have been located in Arviat, and in response, health authorities have tightened restrictions in Arviat, including restricting travel to and from the community.
Diapositive 6. Les populations autochtones courent un risque élevé de propagation rapide de COVID-19 et des conséquences potentiellement plus graves, étant donné une probabilité accrue de vivre dans des maisons multigénérationnelles et dans des communautés éloignées avec un accès réduit aux services de santé et de soins intensifs. Par exemple, contrairement aux phases antérieures de la pandémie, durant lesquelles de nombreuses communautés des Premières Nations étaient parvenues, grâce à leurs efforts, à arrêter de la propagation, le taux de nouveaux cas de COVID-19 dans les populations des Premières Nations vivant dans des réserves dépasse celui de l'ensemble de la population canadienne. En général, les communautés des Premières Nations ont des taux d'attaque et de mortalité plus élevés par rapport à la population canadienne globale. Les taux d'infection restent élevés dans de nombreuses communautés des Premières Nations à la réintroduction et la propagation de COVID-19, y compris celle des variants préoccupants, constitue une préoccupation constante pour toutes les communautés autochtones. Notre exemple, bien que le nombre de cas soit demeuré faible dans l'ensemble des territoires, une récente augmentation du nombre de cas a été signalée au Nunavut. Tous les cas à ce jour ont été localisés à Arviat et en guise de réponse, les autorités de santé publique ont renforcé les restrictions à Arviat, notamment en limitant les déplacements vers et depuis la communauté.
Slide 7. Hospitalization rates have been declining across most provinces since late January. Over the past week, an average of 2,420 people with COVID-19 were being treated in hospitals on any given day, including 570 of whom were in critical care. On average, the length of stay for people hospitalized is about 16 days, or about 20 days for those experiencing more severe illness. The decline in severe outcomes is relieving some of the strain on the health system, though backlogs and an exhausted health workforce remain in many areas of the country.
Diapositive 7. Les taux d'hospitalisation sont en baisse dans la plupart des provinces, et ce, depuis la fin janvier. Au cours de la dernière semaine, environ 2420 personnes en moyenne ont été traitées dans les hôpitaux canadiens chaque jour pour la COVID-19, dont 570 aux soins intensifs. En moyenne, la durée d'hospitalisation des personnes est d'environ 16 jours ou d'environ 20 jours pour les personnes souffrant d'une forme plus grave de la maladie. La diminution des cas graves réduit la pression sur le système de santé, bien que des reports et un épuisement du personnel de santé persistent dans de nombreuses régions du pays.
Slide 8. Since the previous update in mid January, the average number of daily deaths has decreased by close to 58% following the decline in infection rates across the country. Over the past 7 days, there have been an average of 59 deaths reported daily. Those aged 80 years or over account for 70% of all deaths, and those aged 60 to 79 years accounting for 26%. A majority of deaths continue to be linked to outbreaks in long-term care homes. People of any age can experience severe or prolonged illness due to COVID-19. To date, 96 deaths have been reported in adults 20 to 39 years of age.
Diapositive 8. Depuis la mise à jour de la mi-janvier, le nombre moyen de décès quotidiens a diminué de près de 58 suite à la baisse des taux d'infection dans tout le pays. Au cours des 7 derniers jours, 59 décès en moyenne ont été signalés chaque jour. Les personnes âgées de 80 ans représentent 70 de tous les décès et celles âgées entre 60 et 79 ans, 26 La majorité des décès continuent d'être associés à des éclosions dans des centres de soins de longue durée. Les personnes de tous âges peuvent être atteintes d'une maladie grave ou prolongée en raison de la COVID-19. À ce jour, 96 décès ont été signalés chez des adultes âgés entre 20 et 39 ans.
Slide 9. Based on Canadian data up to February the 13th, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to February the 28th. The graph on the left shows the predicted number of cases could be in the range of 841,650 to 878,850 by February the 28th. The graph on the right shows the predicted number of deaths could be in range of 21,510 to 22,420 during that same period.
Diapositive 9. Basé sur les données canadiennes jusqu'au 13 février, les prévisions à court terme montrent les cas et les décès prévus par COVID-19 jusqu'au 28 février. Le graphique de gauche montre que le nombre de cas prévus pourrait se situer entre 841 650 et 878 850 d'ici le 28 février. Le graphique de droite montre que le nombre de décès prévus pourrait se situer entre 21 510 et 22 420 d'ici le 28 février.
On slide 10, this longer range forecast, which we've been using over the past many months, is based only on non-variant COVID-19 virus spread and shows how the epidemic could evolve over the next 2 months without variants of concern. Given the progress we have made in reducing COVID-19 activity across Canada, this model forecasts that Canada could have an average of 2,500 cases daily by the end of February. As always, this outcome assumes that consistent, strong, and combined efforts of individual Canadians and local public health authorities continue. However, the parameters of this model are becoming less useful due to the emergence of variants of concern that have an enhanced ability to infect and spread faster among the population, which this model does not account for.
Diapositive 10. Cette prévision à plus long terme que nous utilisons depuis de nombreux mois est basée uniquement sur une propagation du virus COVID-19 sans les variants et montre comment l'épidémie pourrait évoluer au cours des 2 prochains mois sans inclure les variants préoccupants. Compte tenu des progrès que nous avons réalisés dans la réduction de l'activité de la COVID-19 au Canada, ce modèle prévoit que le Canada pourrait avoir une moyenne de 2500 cas par jour d'ici la fin février. Comme toujours, ce résultat suppose de maintenir des efforts constants, rigoureux et combinés des Canadiens et des autorités locales de santé publique. Cependant, les paramètres de ce modèle deviennent moins utiles en raison de l'émergence de variants préoccupants qui ont une capacité accrue d'infection et de propagation rapide dans la population, ce que ce modèle ne prend pas en compte.
Slide 11. Although it is normal for variants to emerge as viruses continuously evolve, some variants are considered variants of concern because they spread more easily or cause more severe illness, or because current vaccines may be less effective against them. In the past 2 months, more contagious virus variants, first found in the UK, South Africa, and Brazil, have emerged in Canada and have now appeared in all provinces. Starting with a few travel related cases in the early weeks, these variants have been smoldering in the background and now threaten to flare up.
Diapositive 11. Bien qu'il soit normal que des variants apparaissent au fur et à mesure qu'un virus évolue, certains variants sont considérés comme des variants préoccupants parce qu'ils se propagent plus facilement ou provoquent une forme plus grave de la maladie ou parce que les vaccins actuels peuvent être moins efficaces contre ceux-ci. Au cours des 2 derniers mois, des variants plus contagieux du virus d'abord identifiés au Royaume-Uni, en Afrique du Sud et au Brésil ont fait leur apparition au Canada et sont maintenant présents dans les 10 provinces. La circulation de ces variants, qui a débuté par quelques cas liés à des voyages, représentait un feu couvent qui menace maintenant de prendre de l'ampleur et de se propager rapidement.
Slide 12. A new longer range forecast model that accounts for the transmission dynamics of both non variant and new variants of concern is giving us insight into what could happen if more contagious variants continue to spread in Canada. So, this model predicts that with more contagious variants spreading, further lifting of the public health measures will cause the epidemic to resurge rapidly and strongly. That's the orange line. And current community based public health measures will be insufficient to control rapid growth, and resurgence is forecast, the grey line. But if a combination of enhanced community based public health measures and good adherence to individual precautions are implemented and sustained, the epidemic is forecast to come under control. Adhering to individual precautions means that we all must maintain physical distancing, reduce contacts outside of our household to just essential activities, continue with good hand washing practices, and wearing a well constructed, well fitted, and properly worn face mask to protect ourselves and others. For local authorities, this means maintaining or immediately implementing strong public health measures, which may include restrictions, closures, and other community based control measures to achieve the reductions in contacts necessary to get ahead of or prevent further spread of rapidly spreading variants. We've been saying all along that if we ease measures too soon, the epidemic will resurge even stronger. But with highly contagious variants in our midst, The threat of uncontrolled epidemic growth is significantly elevated. This is why measures must be stronger, stricter, and sustained long enough to suppress rapid epidemic growth of various variants of concern.
Diapositive 12. Un nouveau modèle de prévision à plus long terme tenant compte de la dynamique de transmission de la COVID-19 avec des nouveaux variants préoccupants, en plus de la source initiale, nous donne un aperçu de ce qui pourrait se produire si des variants plus contagieux continuent de se répandre au Canada. Avec la propagation de ces variants, ce modèle prédit que la poursuite de la levée des mesures de santé publique entraînera une résurgence rapide et forte de l'épidémie. Ça, c'est la ligne orange. Les mesures de santé publique communautaire actuelles seront insuffisantes pour contrôler la croissance rapide et une résurgence est prédite. Ça, c'est la ligne grise. Mais que c'est une combinaison de mesures de santé publique communautaire accrues et un bon respect des précautions individuelles sont mises en œuvre et maintenues, l'épidémie devrait être maîtrisée. Ça, c'est la ligne bleue. Le respect des précautions individuelles signifie que nous devons tous maintenir une distance physique, réduire les contacts en dehors de notre foyer aux seules activités essentielles, poursuivre les bonnes pratiques de lavage de mains et porter un masque bien ajusté et correctement porté pour nous protéger et protéger les autres. Pour les autorités locales, cela signifie le maintien ou la mise en œuvre immédiate de mesures de santé publique rigoureuses pouvant inclure des restrictions, des fermetures et d'autres mesures de contrôle communautaire pour parvenir à la réduction des contacts nécessaires pour dévancer ou prévenir la propagation des variants à propagation rapide. Nous disons depuis le début que si nous assouplissons les mesures trop tôt, l'épidémie réapparaîtra encore plus fortement, mais avec la présence des variants très contagieux. La menace d'une croissance incontrôlée de l'épidémie est considérablement augmentée. C'est pourquoi les mesures doivent, plus que jamais, être fortes, strictes et constantes suffisamment longtemps pour supprimer la croissance épidémique rapide des variants préoccupants.
Slide 13. The experiences of other countries demonstrate that we can control the spread of COVID-19 even when more contagious variants are predominating. The United Kingdom saw a very rapid increase in cases associated with the emergence and spread of B.1.1.7 variant in early December, when their public health measures were less stringent. They have since achieved a steady decline in infection rates with implementation of strong and sustained public health measures to preserve critical care capacity and enhance border measures to prevent further virus introduction and spread. Israel also experienced a large surge in cases starting in early December when public health measures were less stringent. Although adult vaccinations began in mid to late December, strengthened and sustained public health measures have been necessary to suppress rapid growth as the vaccine coverage increases. With the detection of B.1.1.7 variant in late December, now accounting for a large majority of new cases, and the emergence of B.1.351 in late January, Israel has enhanced border measures to interrupt further introductions, while continuing rigorous testing, genomic sequencing, and tracing to slow the spread of new variants of concern.
Diapositive 13. L'expérience d'autres pays démontre que nous pouvons contrôler la propagation de COVID-19, même lorsque des variants plus contagieux prédominent. Le Royaume-Uni a connu une augmentation très rapide des cas associés à l'émergence et à la propagation du variant B.1.1.7 tôt en décembre, alors que les mesures de santé publique étaient moins strictes. Depuis, ils ont enregistré une baisse constante des taux d'infection grâce à la mise en œuvre de mesures de santé publique fortes et constantes pour préserver la capacité aux soins intensifs et grâce à des mesures rehaussées à la frontière pour empêcher l'introduction et la propagation du virus. Israël a également connu une forte augmentation des cas depuis le début de décembre lorsque les mesures de santé publique étaient moins strictes. Bien que la vaccination des adultes ait commencé entre le mi-décembre et la fin décembre, des mesures de santé publique renforcées et constantes ont été nécessaires pour freiner la croissance rapide pendant que la couverture vaccinale augmentait. Avec la détection à la fin décembre du variant B117, qui représente désormais une grande majorité des nouveaux cas, et l'émergence de la variante B1351 à la fin janvier, Israël a renforcé les mesures aux frontières pour éviter d'autres introductions, tout en poursuivant rigoureusement les tests, le séquençage génomique et le traçage pour ralentir la propagation des nouveaux variants préoccupants.
Slide 14. We are at a critical point in the pandemic, and our efforts have begun to tip the balance in our favor, with overall disease activity declining and initial vaccine programs underway. At the same time, variants of concern have emerged and are spreading across Canada, threatening our progress. Evidence is also emerging that some variants of concern, including the B117 variant, are associated with a higher risk of severe outcomes, including hospitalization and death. But we have solutions. This virus has shown time and again that what works best is a united front, quick action, and a sustained effort. Protecting our progress and limiting the impact of variants of concern will require stronger action through a combination of enhanced public health measures and strict adherence to individual precautions. For individual Canadians, this means following public health advice and doing our personal best by aiming to have the fewest interactions with the fewest people for the shortest time at the greatest distance possible while wearing the best fitting face mask. The path of COVID-19 may not be easy, but we are stronger. We can do this, so let's do it together. Thank you.
Diapositive 14. Nous sommes à un point critique de la pandémie. Nos efforts ont commencé à faire pencher la balance en notre faveur, alors que l'activité globale de la maladie est en déclin et que les premières campagnes de vaccination sont en cours. Dans le même temps, des variants préoccupants sont apparus et se répandent dans tout le pays, menaçant nos progrès. Il apparaît également que certains variants préoccupants, notamment le variant B117, sont associés à un risque plus élevé des conséquences graves, notamment d'hospitalisation et de décès. Mais nous ne sommes pas sans solution. Ce virus a montré à maintes reprises que qui fonctionne, c'est de faire front ensemble, d'agir rapidement et de maintenir nos efforts. Pour protéger nos progrès et limiter l'impact des variants préoccupants, il faudra prendre des mesures plus énergiques en combinant des mesures de santé publique renforcées et le strict respect des précautions individuelles. Pour les Canadiens, cela signifie suivre le Conseil de santé publique et faire de son mieux pour avoir le moins possible d'interactions avec le moins de gens possible, le moins longtemps possible et maintenant la plus grande distance possible, tout en portant un masque bien ajusté. Le chemin de la COVID-19 n'est peut-être pas facile, mais nous sommes plus forts. Nous pouvons le faire et faisons-le ensemble. Je vous remercie.
Merci beaucoup. Thank you very much. Nous allons maintenant passer à la période de questions au téléphone. We'll move to the question and answer portion of the briefing. As usual, you get one question and one follow-up. Vous pouvez poser votre question et votre question de suivi dans l'une ou l'autre des langues officielles. Opérateur, à vous la parole.
Thank you. Merci. Our first question, notre première question, Marie Vestel, Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour. L'un ou l'autre de vous peut répondre, mais je vais poser ma question en français. J'aimerais revenir sur la diapositive 12 avec le graphique, avec les courbes, si on inclut les variants préoccupants. Pouvez-vous juste nous donner des chiffres un petit peu plus précis pardon, sur vos prévisions? Je vois que la ligne orange, la ligne grise monte très rapidement, la ligne bleue descend, mais le graphique n'est pas super précis en termes de termes. Pouvez-vous nous donner, par exemple, le nombre de cas qu'on atteindrait à une certaine date avec la courbe orange, grise et bleue?
Merci, c'est Dr. New. Peut-être que je peux commencer. Je pense que le graphique, c'est pour montrer en général qu'est-ce qui peut se passer au futur. Si, si on ne continue pas avec les mesures de santé publique très strictes et ce n'est pas vraiment une question avec les chiffres exacts. On peut peut-être, avec nos experts de modélisation, on peut vous donner peut-être après des chiffres plus exacts, mais c'est toujours la même situation. On dit toujours, c'est pas une boule de cristal, c'est des modèles pour la planification et on ne peut pas vraiment donner une date exacte avec des chiffres, mais c'est sûr, on peut consulter avec nos experts et peut-être on peut donner plus des détails comme disponibles. Je ne sais pas, Dr. Tam, est-ce que vous avez quelque chose d'autre à ajouter?
Non, pas vraiment, mais c'est pour démontrer que si on lâche notre effort, euh, il y a vraiment une rapidité de recrudescence de cette épidémie. Et pour ce modèle, on a assumé que les variants d'intérêt sont 50% plus transmissibles. Donc, on peut ajouter plusieurs scénarios, mais c'est une des possibilités pour le futur.
Si possible, ouais, si vous pouvez nous revenir avec des chiffres, parce que j'imagine qu'en tant que scientifique, vous comprenez qu'on ne veut pas faire d'erreur et on ne veut pas deviner à quelle date on atteint 20 000 cas ou plus ou moins 20 000 cas, donc ce serait le fun de préciser. Mais sur les mesures, vous dites qu'il faut pas les relâcher, qu'il faudrait même les resserrer, les mesures actuelles sont insuffisantes, vous dites. Qu'est-ce que vous voudriez voir? Avez-vous des suggestions précises pour les provinces? Est-ce qu'il faut laisser un couvre-feu comme c'est le cas au Québec? Est-ce qu'il faut refermer des commerces comme les coiffeurs ou autre chose comme en Ontario? Avez-vous des suggestions plus précises de ce qui doit être fait au-delà de dire qu'il faut en faire plus?
C'est Dr. New, peut-être je peux commencer. Je pense qu'on a constaté que si on veut comment dire, enlever les mesures de santé publique des autorités de santé, par les autorités de santé publique, il faut faire ça avec beaucoup de prudence, pas, pas trop tôt, pas trop rapidement. Et il faut aussi avoir un bon système de surveillance comme dit, pour dépister, tracer, s'isoler aussi pour tous les cas. Parce que si les indications et le taux d'infection, aussi des autres, même après les indicateurs tardifs comme les taux d'hospitalisation, aussi les décès, ça, c'est vraiment, c'est trop tard. Il faut vraiment avoir n'importe quel signal qui démontre peut-être que le taux d'infection commence à augmenter. Mais aussi, si on voit aussi que peut-être le nombre, la proportion des cas causés par les variants commence aussi à augmenter, c'est un signal, d'après moi, pour les autorités de peut-être renforcer, mettre en vigueur encore les restrictions plus strictes.
Merci. Prochaine question.
Thank you. Merci. Our next question, notre prochaine question de Marika Walsh with the Globe and Mail. Please go ahead. À vous la parole.
Hi, thank you so much for taking our questions. Dr. Tam, I'm wondering if you can give a bit more clarity on the variants. Is it accurate to say that these models show the variants will replace, the original COVID variant in Canada in the next 2 months? Will the variants become the dominant strains of COVID in Canada?
Well, as I indicated, viruses will undergo evolution as they spread. So the more spread there is, the more abilities for this virus to continue to mutate. And so, and there are different variants. So there is an international effort, of course, now to try and classify these variants and determine which ones are the ones that we need to pay most attention for. The models themselves are only trying to illustrate what would happen if you have a variant of increased transmissibility. So that's what the slide 12 is trying to show. It doesn't demonstrate, of course, the other impacts, such as is it causing more severe illness, etc. And it does not illustrate necessarily whether a variant will replace or not what's the preceding viruses that are going on. I think that the trajectory could be different for the three variants that we're tracking right now. The B117 variant, for example, has been seen in numerous countries. So I think last time I saw was over 85. So you can see that this variant is becoming much more common. Whether in different areas of the world it would then become the predominant virus remains to be seen, but it has been the predominant virus now in a number of European countries, for example. So this is one variant where we might expect it to become the new sort of circulating virus. The other ones remains to be seen. We're not seeing that many cases of those. There's still quite a number of countries reporting them, but they are fewer in number. So it's possible that they will disappear one day, or they will replace the current circulating strains. So, but the B117 variant for sure is the one that appears to becoming very common. And you've seen some of the data, I think, coming out of Ontario, showing that it could be around 7-8% of the I guess samples that the positive samples that they've screened. And so that is showing us that right now is not that prevalent. Could it become more prevalent? That is a possibility for sure.
It's Dr. Njoo.
Okay,
Maybe I
and
could just add a few points to Dr. Tam. I think, whether the variants become, as you say, more predominant in Canada, I think at the end of the day, it all depends on us as Canadians. As Dr. Tam stated, the virus normally, naturally continues to evolve and maybe have mutations. So the less that we, sort of have contacts with each other and limit the spread of the virus here in Canada, that would also limit the ability of the virus to continue to, obviously mutate and so on by having more hosts to infect. The other point I think that's important to stress is, as we've said all along, Canadians should not be traveling abroad for non-essential reasons. As you can see, if you go abroad, not only might you be at risk of getting COVID-19, but you might be picking up a variant, emerging variant in another country and bringing that back to Canada. So I think those 2 points need to be underlined as well. Thank you.
thanks for that. So I understand that this is not a crystal ball, but can you be any more clear, at least in terms of how likely this is? You're saying that it's not a guarantee that we are going to see, I guess if you're saying that the variants might not become predominant in Canada, then we wouldn't see these really big numbers that are spelled out on slide 12. So how likely are you saying that slide 12 is? Like, is slide 12 the new baseline, I guess is the question, or is this just the worst case scenario?
Well, I think given what we've seen in other countries and the fact that the B117 variant, for example, which appears to be more transmissible, is already in Canada, I think that slide 12, as you put it, is a current reality. And so if you want to look at it as the new baseline, you can. The preceding slide that shows what we could do if we continued our efforts is still possible. So that's the one that is discounting the entry of the variants. But I think from my own perspective, we got the variants in Canada, particularly the B117. That one is looking like it could be difficult to contain, as it were. So that if we let go of some of these measures and you don't do it slowly, thoughtfully, bringing the population along with continuing some of their personal protective practices, you're going to see a resurgence. Because for a number of reasons, the population immunity is probably still quite low in Canada. We got these sero surveys, very few of the population immune. Our vaccine programs are beginning to escalate, but they haven't got to a point where enough people are protected. And then you look at a place like Israel or the United Kingdom. They've been vaccinating more people than other areas, and they still had to put in the public health measures to slow down the virus while their vaccine program is escalated. Which is why I think in the next couple of months, well, this model could go further. This is a potential scenario that we have to be absolutely aware of. So I think I don't know if that answers your question, but really the message is that if we let go, we got to do it really carefully, and for the most part, try to keep up with what you have now. But this rapid response is needed if you suddenly see an increase in cases and tests and sequence and look for those variants.
Thank you. Next question.
Thank you. Merci. Our next question, notre prochaine question, Mackenzie Gray with CTV News. Please go ahead. À vous la parole.
Hi, my first question is for Dr. Tam. Dr. Tam, throughout the slides and in your remarks today, you've said that we need stronger action taken. Yet many provinces across the country are easing restrictions right now. Have you raised the need to have stronger restrictions at this point with your provincial colleagues? Because it does not seem like the provinces are listening to what you're saying.
Well, of course, we are in constant communication with chief medical officers, and they, again, as usual, in this big country of ours, each of them are experiencing things in a slightly different way and have different contexts. But I think they're all vigilant and know that if you ease anything at all, it better be slow with a lot of surveillance, testing, and that there needs to be a commitment to rapidly respond if things escalate. And I do think that given all the things I've just said, a resurgence is very likely if people let go of the public health measures right now. But what you want to do is to keep avoiding, I think, this yo-yoing effect of up and down, and you need to avoid complete lockdowns and curfews and all those things by trying to maintain a strong level of public health measures. And so, I don't think any of the population or businesses or others just want to see, us keep, provinces keep sort of going up and down with their measures. Um, I think the initial really careful easing. Why would you ease your measures? Well, only if you got the sequencing in place, you got your testing to a good level. You know that when you find a case, you can detect the contacts. If those things are not well in place, one shouldn't be easing those measures. You can't just keep doing the same thing and expect a different result, right? So you have to have enforced those other public health capacities in order to be able to cope with any signs of uptick.
I'd like to know in the modeling how much you have factored in an increase in the ability for Canadians to get vaccinated in terms of the number of cases and the number of deaths. And can you give us a number of how many Canadians will need to be vaccinated for there to be a meaningful decrease in either cases or deaths?
So right now, I think the supply projections are posted, and to a certain extent, so we are still in a period where the supply of vaccines is just escalating. So for the next months, we're not going to have a lot of people vaccinated. So that's a fact, right? So then. In terms of seeing a decrease in hospitalization and death, that is possible because we are now throughout Canada trying to provide vaccine to the priority groups, including long-term care homes and seniors and those at high risk of exposure, such as the healthcare workers who look after them in the long-term care homes. You would have seen some sort of media sound bites on some of the results that provinces are seeing, including British Columbia and Quebec. Even with one dose of vaccines, they're seeing a high vaccine effectiveness. And I've heard we will, by the end of this month, calculate how many long-term care outbreaks in February, because February is only sort of halfway through. But you can see from that graph included in the slides that you're going to see a trend down, and the number of persons in the linked to those outbreaks decrease. And given that such a significant proportion of severe outcomes and deaths are linked to those high-risk populations, we will, I think, see that impact quite soon. And we're seeing some of that now. We need to see the sort of publication of the results. But that is actually a really good news. People need to remember that. But we need to keep going with the vaccine. And in order for the vaccine to have the best runway it can to take off, you need to make sure those cases are kept low. And it'll be a while before you can even get to a certain percentage of the population getting vaccinated, and each time you're focusing on a slightly different group. The reason we showed also the international slides is that we will always look towards other countries for lessons learned, and for Israel, for example, that's undergone a lot of vaccination in their communities. They've got a combination of public health measures and the vaccines going at the same time. But we do know that based on the data, the vaccines work very well. And so that combination of measures has enabled that country to see its curve go down. So we'll be able to sort of judge a bit more, and the modelers will take into account these new parameters as they learn about them, and the models can be adjusted over time as well.
Thank you. Next question.
Thank you. Merci. Our next question, notre prochaine question from Catherine Lévesque avec la presse canadienne. Please go ahead, à vous la parole.
Oui, bonjour à vous deux. J'aimerais retourner sur les chiffres concernant la courbe, plus précisément, en fait, les courbes qu'on retrouve à la page 16 en annexe. Bon, je sais que vous dites que vous n'aviez pas les chiffres, là, ma collègue Marie-Vastel, mais quand même, là, la courbe orange, surtout, est très inquiétante. Je me demandais, avez-vous un estimé ou juste une idée en moyenne du nombre de cas là, qu'on pourrait retrouver au 1er mars ou au 1er avril avec cette courbe orange? Et si vous avez les chiffres pour la courbe grise également? Merci.
C'est Dr. Njoo. Moi, je n'ai pas comme les chiffres exacts. C'est sûr, on peut toujours vous donner peut-être plus tard des chiffres selon nos experts au sein de l'agence, parce que c'est les autres qui ont préparé les diapositifs et beaucoup de détails, des données plus détaillées. Mais je pense que c'est peut-être la meilleure façon, au lieu de moi au moins de donner une estimée et peut-être que peut être très bien précis, pas être capable de bien préciser. Je sais pas, Dr. Tam, est-ce que vous voulez dire quelque chose aussi?
Pas vraiment. Il y a c'est pour illustrer comment on pourrait le courbe pour les scénarios différents, c'est tout. Mais on peut dire que il y a une situation assez différente entre les provinces. But it's not inevitable, those curves. So, for example, if you looked at any number of those provinces, what they do now, if they don't let go of anything and the variant comes in, this might happen. But if there are no variants detected, that trajectory would remain more like the current state. But you know, it's to illustrate that if the variants do come in, I think from one of our previous questions, if the variants do come into a province and they lift their public health measures, that is not what you need to see. If you see a variant come in, and you need to increase your measures in order to get it under control. So that's pretty much an illustration, again, with the assumption of a variant as 50% more transmissible, which is a sort of ballpark as well. So you can't be absolutely certain about that kind of thing. But, just for illustration, right now we're only seeing under 3,000 cases a day right now. A variant that comes in 50% more transmissible and you release your measures, you're looking at thousands more a day. And remember, we were at over 8,000 cases a day at the beginning of January, and it could be more than that. That third sort of resurgence, that third curve going up can be way more than 8,500 cases a day, is what this model is trying to demonstrate.
Sûrement, on peut souligner le point, c'est pour illustrer le point, il n'y a pas comme à fixer vraiment sur les chiffres exacts. Donc, merci.
OK. Ben, respectueusement, c'est un briefing technique, alors on se serait attendu peut-être à plus de précision. But I just want to continue on what you were saying, Dr. Tam. I was just wondering, I know that the situation will be different in every province, but let's say in the cases of Ontario or Quebec, for example, right now, those two provinces are easing their restrictions. Considering there are variants in those two provinces, are we in the current state going on the gray line, or are we going towards the orange line? It's in those two provinces.
I think, again, you're going to see the impact of these measures within that sort of 2-week or so time frame. And this is the issue with this virus, is that you release your measures now, you're going to see what happens in a couple of weeks. And so you can't quite tell where that trajectory is at the moment. But if there's not enough capacity to do enough testing, tracing, and sequencing, then that there's a distinct possibility that the gray line will veer towards the orange line. How much it veers towards the orange line remains to be seen. But we do know that in Ontario, for example, the B117 variant has been detected in multiple health units and has already caused some outbreaks. So at the same time, if you want to reduce the impact, you need to make sure all those long-term care facilities and residents and seniors are vaccinated. And so these layers of measures need to be in place. But I do think that from the chief medical officers, they do recognize that you can't just release the brakes entirely. You're going to have to do it really carefully. Some of our recommendations have been do it very small. Most provinces are going to focus on, can we get kids back to school? So that's one setting. Look at what happens to that for like 3 weeks. Don't sort of keep adding on the easing of measures. Give it enough time to see what actually happens in order to inform whether you need to tighten or whether you can continue on the current state. So that's really critical. If you release your measures without increasing the capacity to manage cases and contacts, then resurgence will occur.
Okay, we're running out of time. We have time for one quick class question. Operator.
Thank you. Merci. Our next question, notre prochaine question, David Thurton from CBC News. Please go ahead. À vous la parole.
Hi. Doctors, I'm just wondering if you can tell us anything about this new study that shows that the Pfizer-BioNTech vaccine, just one shot of this vaccine packs quite a bit of a punch. What does this mean for your guidance on the administering of maybe just one dose in future?
That is a really great question. And I think it's great to end on that question, actually, because we can be very optimistic, I think, about the performance of the mRNA vaccines, I think. There are studies now beginning to emerge, both abroad and in Canada, that just that initial dose packs quite a punch, as you said. some new data, for example, from Quebec and from British Columbia, but also reported as a roundtable, if you like, by other jurisdictions, shows that after one dose and after the people who are vaccinated, 2 to 3 weeks later, you see a very high vaccine effectiveness, and certainly over 80%. And why that's good news? One is that in the clinical trials, many of the participants are not, some of the healthier participants, if you like. What we've now demonstrated is that the vaccine is highly effective in the most senior of our populations who have a fragile health status, like those in long-term care in a congregate living setting. So that's a real life demonstration of just how good that vaccine is, even several weeks beginning after the first dose. What it's also telling us is that if that efficacy is so high, 3 to 4 weeks later, and in fact, there's emerging evidence to show that even beyond that, and into that 42-day zone, then it's very unlikely that it's going to drop off, the next weeks. And sometimes these vaccines can actually increase. You see an increasing vaccine effectiveness as the interval increases as well. So that kind of data is being reviewed. The investigators, the public health experts who generated those data are presenting to the National Advisory Committee on Immunization, which is the committee that looks at our recommendations. So I think that as that data evolves, I think, first of all, Canadians should be reassured that if you didn't get your first dose till a little bit later, that is unlikely that has an impact. It is not a recommendation to have a 1-dose schedule. It is still a 2-dose schedule, but looking at how far you can stretch that interval. And why that is important is you can cover more people, of course, with the first dose if you can stretch that interval. So that's a very live discussion right now, and the analysis is going on. But it is incredible, I think, that we have such an efficacious tool, and we just need to sort of hunker down to get the vaccines implemented and people to roll up their sleeves when the time comes. So thank you.
Okay, so if you have a follow-up, go ahead, but
Yes.
please, everyone, keep it short.
Yeah, and forgive me for asking this question, Dr. Tam. I know you're not the regulator, but we have more access to you. You're easier to access than the regulator. But can you give us an update on the AstraZeneca vaccine? What is the regulator telling you about the approval of this? Again, sorry for asking this question, but you're just easier to access than Health Canada.
I got the answer to the question yesterday.
Oh, okay. Well, you keep answering.
No, you can
Just
say the
ask it
answer
every day. That would be the appropriate thing to do. And so, because as you say, I'm not the regulator, but I know they're working very hard at this. And at the last update that you had from them, they said it's sort of soon. So I think that's still the answer as far as I know. But just to say that at the same time, the National Advisory Committee on Immunization has reviewed the same data so that they can be ready with a recommendation when the regulator is ready. So all of this, again, is being done concurrently so that we don't lose any time when the vaccine is available.
Thank you so much. Merci beaucoup. C'est ce qui complète le briefage technique. This is the end of our technical briefing.